the art of making Tumescent anesthetic. Earlier on I had given you the formula, whereby we take 1 liter of normal saline. As you can see, we use a normal 1 liter bag. Please note there are modifications, but according to our Professor Larry Field, whom we consider the guru of liposuction, we do not change the winning formula. So in 1 liter of normal saline, keep it aside, we add our lignocaine. Lignocaine we use 2%, so that means there is 200 milligrams, 2% means there's each bottle there is 400 milligrams of lignocaine. And we're using 2, then we use 800 milligrams per liter. This is very important. One must understand that lignocaine has a toxic level in the body. There's various formulas to determine the toxic level, but we use an arbitrary figure of between 50 milligrams per kilogram body weight. So in the patient we are going to do today, her weight is 50 kilograms, so we will not exceed more than 2,500 milligrams of lignocaine. Therefore, we will not mix up more than 3 liters of Tumescent anesthetic. 3 liters means 3 times 800 milligrams, which gives us 2,400 milligrams. So we're slightly below the toxic dose, which some experts say can be up to 55 or 60, but we are dermatologists and we do not wish to harm anybody, so we play it safe by using the 50 milligrams per kilogram body weight. So what happens is we mix it up. We use a rather wide bore needle. Get me some alcohol. Pariksha is a qualified nurse. She helps me out with most of the procedures. And as you can see, we pull out the 20 cc, which contains 400 milligrams of lignocaine. We inject it into the 1 liter of normal saline. Now we're using the second vial. So in this vial, in this 1 liter, you have 800 milligrams of lignocaine. Now what happens is the pH comes down dramatically. So the pH comes down by about 4 degrees. Remember we're using normal saline with a pH of around 7. And then we're adding more of adrenaline. We give adrenaline. We use adrenaline because of its good vasoconstrictor properties, so that when we're doing the liposuction, it causes proper vasoconstriction and the bleeding is down to a minimum. So now we've got a bag which contains 2 amps of lignocaine, which is basically 800 milligrams of lignocaine, and it contains 1 amp of adrenaline. And 1 amp of adrenaline is 1 in 1,000. However, the pH comes down dramatically. The pH is now sitting at about 3. And as you're aware that if you put in anything acidic to the body, it is going to cause a tingling and burning sensation, and this is going to be used internally. So what we do is we buffer it with sodium bicarbonate, so that we get back to the pH of 7 as close as possible. The formula says that we should use about 12.5 ml, and this is what we exactly do. We go about 12.5 ml of sodium bicarbonate. We use this as a buffering agent. There is basically no scientific value when it comes to anesthetic, but we use it as a buffering agent so that when the anesthetic is used on the patient, then it has a proper pH control. So we're now back to 7. We give it a good squeeze. And since we've got lots of anesthetic line around, so what we do is we mark this. Various people got different. This tells me this contains lignocaine, 800, 1 amp adrenaline, and 12.5% sodium bicarbonate. It's only when I put a tick, then only, and I sign it, then only I put it onto my claim.